Hello friends, I am Dr. Waseem, family physician at Craft Hospital, Thrissur, Kerala. And today we are going to view what is the preparation mode for a theory exam and how to write a theory paper at the end of the video. So while preparing for a theory exam, all of you definitely must be by now aware of what all books we need to prepare. So you need to keep the materials which you're reading fixed. You need not change the materials very often looking at your friends or the other people who are giving you suggestions, things like that. You need to keep a standard list of textbooks or materials which you have to prepare continuously for throughout your year or throughout the curriculum which you are supposed to. And while you're following the standard books, you need to keep them updated by following other guidelines or any updates which come across in your preparation period. So you need not keep on changing books based on your easy mode or what your friends do, things like that. So after that, you need to write down all the points or at least keep all the highlighted points in your reference textbook. Such as if you read like few textbooks, like 2 or 3 textbooks, make one as your standard textbook, keep the other 2 as reference books. What you need to do is the standard textbook or the standard material which you are having, you need to write down what are all the points which are not there in this book and which is there in that book. Only the important keywords is what you will have a space to write in the textbook. Otherwise, if you are in the habit of making notes, which is like very uncommon in a medical student's life, because the volume is large and we will not be able to succeed in writing all the notes which we want in our entire training program. So whatever we want to write, we can write and keep, like few very important things which is not there in the textbooks and very few very rarely asked questions which you can see only in websites and other journals or things like that. Apart from that, all the majority of things will be there in the textbook only. So on top of that, you need to write all the important points which are not there in the standard textbook, so which you are using as your personal textbook. So make a note of all the important points and keep it for your exams and revision purposes. Then be confident and stay motivated. Your confidence and motivation is the only key for your success. Beyond preparation, you need to be confident and motivated. Don't keep looking at your friends and get demotivated or lose your confidence that this person is preparing this much, I am not preparing that much. Keep that as a motivation factor and try to force yourself to be more hardworking and more dedicated towards your preparation purpose. And next, coming to the exam preparation, while you prepare for a question before your exams, what you need to do is that you need to write down or list down all the important points alone for that particular question. Most of us will be looking into all the question banks of the previous years, and then only we will be deciding what all topics we need to give stress on. Now the trend is usually to give you all the important topics in the theory exam. That is what the examiner also has in the mind. Few examiners who are like very often irritated that because these questions are often being repeated might try to change the question or give you a new set of questions which may kind of disappoint you during the exam time. So what you need to do is you need to be prepared for all the questions asked from the textbook or from your curriculum. You need to be very much prepared for everything which can be expected in the exams, because not all points or not all chapters in the textbook is going to be covered in your theory paper. Only very important, maybe 10 or 20 questions is what, or topics is what is going to be covered in your theory paper. So based on that, you need to be very thorough on all the topics and keep an idea of what to write for every kind of question which is asked. Usually in medical exams, in clinical topics, all the answers would start as like introduction or definition, etiopathogenesis, clinical features, signs and symptoms, management, which includes investigations and diagnosis, follow-up and screening, and any other important points or clinical signs or things like that. So keep things organized. Every answer is going to be of a same pattern, and you need to highlight what all important points you have to write during that particular theory theory question. Okay, and before you go on to the preparation, plan your work and try to work your plan. That is what we always say. So when you are planning your work, suppose it's not working out, then try to replan. try to fix a schedule, try to solve all the distractions or the hurdles which you are facing during your preparation, and try to keep them away, and try to plan things in such a way that your study table or your timetable is going on in the correct way. Suppose you are not following a particular timetable over a long period of time, then it may lead to an internal dissatisfaction that you are not doing your best. So don't let that happen. Try to optimize your timing, try to fix a timing which is possible. Don't try to fix very impossible, like adverse timings, like say I would read 20 hours a day and I'll only rest 4 hours a week. This is practically not going to be possible for a human being, because we need to have adequate sleep, you need to have adequate food, you need to have adequate rest, you have even other activities that every average human being would be having. So for all those things we would definitely need some time away, some time kept away for all those activities. So what I would say is that a 12 to 16 hours of daily study period would be the ideal study period which can be possible during our study leave period. Otherwise, during your curriculum and your course period, you have to fix at least 2 to 4 hours of daily reading, or at least weekly you should fix around 20 to 30 hours of weekly reading period. So during your reading, not only you are going to read once, you are trying to recollect the other previously read things again and again. So only when you do that, you will be able to remember whatever you have read in the last 1 week. So when you are reading the next new topic, try to recollect what you have read yesterday, or when you are sitting free in the classes, or when you are going out somewhere, or when you are sitting idle at home, try to recollect all the important things which you have read previously or just some time back, because your memory, there is like short-term memory and a long-term memory. The stuff which we read now gets into our short-term memory, and making it enter into the long-term memory is the key to success. So once you make it enter into the long-term memory, then it's not going to be a problem at all, because even if they ask you after 1 week or 1 month or say even 2 months, you'll be able to tell at least half of what you read, and like half of what you read in the textbook, if you are able to remember, that is like more than sufficient to pass an exam, is what I have understood. And always fix materials, don't keep changing your notes, okay? Always, as I already told you, don't keep changing your study materials, keep a fixed set of notes. If your friends are giving you any other important points or important extra topics or matter, then you keep jotting them down in the textbook or your notebooks whichever you are following. And all the theory topics do have some sort of a clinical evidence or clinical approach based significance. So you need to read all the theory topics from a practical point of view, then only you will be able to remember all the theory topics whatever you are reading from a clinical point of view. At the end of the day, these theory questions are not going to help you at all. Your practical experience and your approach to the patient, everything is what going to make you a good doctor. Unless and until you are going to choose a non-clinical medical field or a paraclinical medical field, then or you're going to just skip out of the medical field and you're going to take any administrative works or something like that. Then otherwise, if you are in a pakka clinical field, then all the important practical oriented points, if you're able to remember at the end of the day, that is like more than sufficient. Try to understand the concepts in your mind, have concepts clear in your mind. These concepts will never go away from your mind. Whatever theory questions you are going to read, keep the concept in your mind. For example, if Rappaport lumbering cycle, I had read it say around 6 to 10 years back. So if you ask me the Rappaport lumbering cycle, I definitely would not remember it, or the Krebs cycle, or whatever the fatty acid synthesis which we read in the first year and maybe in the entrance preparation and things like that. All these topics are like not so very clinically important, or we would not expect the entire pathway to be remembered in the clinical practice. Only the few important things and very few uncommon like endocrine disorders or metabolic disorders is what we would get associated with all these things. So when you read some topics, try to relate this in a practical way, what all things practically can happen because of these pathway and the problems. Then you will remember most of the things which you are coming across in your theory preparation. And before going on to writing a theory paper, you need to have adequate sleep, rest, and you should eat properly. Your health is going to be very important when you are preparing for the exams. So stay healthy, keep reading and be motivated. That is what is going to help you at the end of the day. So whatever points you're reading for the exam, keep it highlighted in your textbooks, or underline, whatever you feel to be convenient for you, you can follow it. And when it comes to sleep times, try to split your sleep times, because sometimes a fixed sleep and a long period of togetherness of reading will not be very helpful, because our body gets stressed out after a particular period of time. You would have experienced in your classes, suppose it's a 30 minutes or a 45 minutes class, after 15 to 20 minutes of attending the class, your attention span is going to go off. You will not be remembering it anything at the end of the day. So you need to have some split up times. After every question, try to take a break for 30 seconds, try to recollect, or just have a glass of water and try to refresh yourself. That is what is going to help you. So keep away from all the distractions, all the mobile phones and all Facebooks and YouTubes and unwanted things. All these kinds of things you can keep out of all your preparation time. So at the end of the day, 24 hours is the same for everybody. Your friend and myself and everybody else around you is having the same 24 hours. So make use of the 24 hours. Nobody is getting less time, nobody is getting more time. It depends on how you utilize your time at the end of the day. So time waits for none, neither you nor me. We all know that. So make use of the time in a proper way. And better be well prepared for the exam. Stay confident. This is what is going to help you at the end of the day. So in the next video, I'll be sharing with you on how to write a theory paper, and we would just get more crisper in the next video, so that you know that what all the points the examiner would expect at the end of the day in your theory paper. Okay, stay tuned. Bye.